Welcome everyone to ACS Connect. This is our first episode where we are connecting the dots in health equity here at the American Cancer Society. I am your host, Kristina Martel, and I'm coming to you from Los Angeles, California, which is native Tongva land. We have an incredible show lined up for you today. It is Asian American Pacific Islander Month, and our first guest is Cha Si from American Cancer Society Cancer Action Network. And we have an amazing person who is doing great work in narrowing the health equity gap in Hawaii. That is Srue Wakuk, who is a community health educator out of the University of Hawaii. So we hope you enjoy the show. Stick with us. Thank you. Welcome, Cha.
Hi, Kristina.
Hi, how are you doing?
I'm doing great. How are you?
Good. Happy Asian American Pacific Islander Month.
Likewise.
And I know that you are Southeast Asian, and tell us more.
Yeah, so I was born in Thailand. So as you mentioned, I consider myself Southeast Asian. My ethnic background is Lahu. Many people don't know about Lahu, so it's spelled Lahu, and Lahu is an ethnic minority of Southeast Asia. And I am part of the American Cancer Society Cancer Action Network, also known as ACS CAN, here in California. So ACS CAN is the nonprofit, nonpartisan advocacy affiliate of American Cancer Society. So what we do is we support evidence-based policy designed to eliminate cancer as a major health problem. And a lot of the work is done through partnership with community volunteers and organizations. Here in Central California, I oversee our tobacco prevention project, and our main target is to address health disparities related to tobacco and cancer prevention.
You're doing great work, Cha.
Thank you.
And I know that you have some statistics and cancer information about cancers affecting the Asian American Pacific Islander community and some disparities numbers. So please share.
Yeah. So in the Asian American and Pacific Islander community, cancer disproportionately affects the population and even the subpopulation groups. For example, we see that AAPI individuals are twice as likely to have stomach cancer than non-Hispanic whites, and AAPIs are more likely to die from stomach cancer than non-Hispanic whites. Also, AAPI individuals have almost twice the incidence of liver cancer when compared to non-Hispanic white population. In the AAPI community, there are also many subgroups. So when we talk about the cancer crisis, it's very vital to disaggregate the data. For example, liver cancer rates in Laotian and Vietnamese men are 2 to 4 times higher than those in Chinese, Korean, and Filipino men, and almost 10 times higher than Asian, Indian, and Pakistani men. So some of the ways we are trying to address health equity issues is through a community participatory approach. We're working with the volunteers from the communities to provide education, to improve their knowledge about prevention and behaviors, as well as mobilize and empower community members to advocate for systems and policy changes that will improve their lives.
Thank you, Cha. And for those who want to get involved and mobilize in their community, how can they get involved with American Cancer Society Cancer Action Network?
Yeah, so I would encourage people to check out our website. It's fightcancer.org. And there's a lot of information on there about national, state, and even some local effort information.
Great. Thank you so much, Cha. Thanks for sharing this space with us.
Thank you, Kristina. Have a good day.
Thank you. You too. Welcome, Srue, to ACS Connect, and happy Asian American Pacific Islander Month.
Thank you, Kristina. Hello, everyone. And it's a pleasure to be here to celebrate with you the Asian Pacific Islander Month.
Thank you so much for being here and sharing this space with us. You are doing incredible work in the Micronesian population in Hawaii and in narrowing the disparities and educating women, Micronesian women, about cervical and breast cancer. Can you share more about your work?
Thank you, Kristina. Here at the University of Hawaii Cancer Center, as a community health educator, my role is to help my fellow Pacific Islanders, especially Native Hawaiians and Micronesians, in getting cervical and breast cancer screening, and knows the importance of screening for women, especially this population. I have been out in the communities raising awareness about breast, cervical, and human papillomavirus to my fellow women, fellow Micronesian women or Pacific Islanders here in Hawaii. Currently, I am involved in a clinical trial study that aims to increase the accruals of Micronesian women and Native Hawaiian women that are participating in clinical trial study. So I circulate around different communities, different cultures in educating women about the importance of Pap test, mammogram, and encourage them to take a step forward and get screened, because this population, in many studies, it identifies that women from this population are susceptible to breast and cervical cancer.
Yes, and Srue, what are some of the barriers that you are discovering in your work that are keeping women from getting screened? Is it some cultural barriers? Is it resources, access to care?
It can be all, it can be both. Cultural barriers, like for Micronesian, women are expected to stay at home. So women are also like the backbone of the family. So when something happens in the family, they always sacrifice their health and themselves and prioritize everybody first before them. So if there is a meeting at school, if there is an appointment for their kids or husband, most likely they will go to attend those instead of coming to their appointments. That is one of the common issue that we have been seeing among this population. The other one is access to healthcare. Not everybody knows that there is a free program called Breast and Cervical Cancer Control Program exists here in Hawaii that can help pay for the screening for these women that have no insurance or that are underinsured. So these are some of the things that I help in educating this community, that there are programs like this exist, and they can access it in order to help them get regular screening without paying. There's also issues with, I would say it relates to socioeconomic. Most of this population are living in multi-family homes, which it can be cultural, and also it can be due to, as I mentioned, socioeconomic factors. Because here in Hawaii, it is very expensive and not everybody can afford. Therefore, we are holding on to our cultural practices even though we are away from home, where we live in extended families with many people in order to survive.
It's all about survival, really, and talking about some of those cultural barriers, and you are doing such incredible work in educating women about the importance of cervical and breast cancer and HPV. We could not, at the American Cancer Society, do our work without people like you. Thank you so much for spending this time with us, sharing this space, and we'd love to have you back. Will you come back?
Sure, it will be a pleasure to be back, and I'm very thankful to be here today to celebrate the Asian Pacific Islanders Month. Thank you, Kristina.
Thank you so very much. I'm grateful. Thank you. Thank you so very much for joining us. We want to thank our contributors to ACS Connect. We have several staff that are involved in making this happen here at the American Cancer Society. We want to thank our guests, and also the music that you're listening to was brought to you by Hector Ortiz, Cello Azul. And we will be back around the same time next month to celebrate the culture of Native Americans and talk about disparities of Native American and Indigenous people as it relates to cancer and health equity. Thank you for joining us with much gratitude.